It is still the conversation, and thank you for staying tuned. One of the pillars of Governor Babajide Sanwo-Olu's Teams Plus agenda is health and the environment. It is the second pillar. Our focus is on the health aspect of this pillar, and our discussion is centered on Lagos State's mandatory health insurance. There is an executive order mandating all residents, employers and workers in Lagos State to subscribe to a social health insurance scheme. The state government is also making moves towards achieving universal health coverage to ensure every resident, irrespective of socio-economic status, has access to quality health care. And to shed light on this significant development and how it will impact the lives of Lagos residents, we have here with us Dr. Emanuela Zamba, the Permanent Secretary of the Lagos State Health Management Agency, LASHMA. You're welcome, ma'am.
Thank you for having me.
Good morning.
Good morning.
I think the best way to start this morning, I know the LASHMA health insurance scheme has been on for a while. So how receptive are Lagosians to this scheme so far?
I would say it's not bad. And what I mean by that is that health insurance is something that's alien to our culture, generally speaking, across Nigeria. Even though Lagos is more cosmopolitan than the others, it's still something that people have a bit of a struggle understanding why do I have to pay for a sickness that is not going to come, largely because of ignorance and, you know, the spiritual aspects of God forbid is not my portion, etc. So I think the people that are aware are those that are already under health insurance within the corporate setting. For the informal sector, which is where the larger percentage of residents reside, it is a struggle trying to get them to understand. However, if we look at where we started in 2020 in the thick of COVID and where we are now in 2024, the journey is a progressive and an upward one. Certainly there is a lot more awareness about Iliraiko across Lagos, and we are getting, you know, much more buy-in than we had before. So yeah, it's a journey, but it's improving every day.
Okay, with the executive order mandating all, you know, to be on the health insurance scheme, and the executive order also aligns that there will be a 6-month sensitization period. So how is this going before you start enforcement?
Thank you. So I'm here today. We have a work plan which we're rolling out to see how we can touch every single segment of society across board, using all the various media platforms to be able to do that. So we'll be on TV, we're on radio, we'll be in the communities having community storms and door-to-door campaigns. We'll be meeting with community leaders and all the gatekeepers of the community, etc. We'll also be meeting with some corporate bodies are not under private health insurance, maybe because of affordability and so on. So we will be also interacting with that set of people. We'll be going to schools. We're touching every single subsegment of the population. And yes, that would be over the concerted period of 6 months.
My major concern for this particular executive order is those at the grassroots, because of their perception, their level of exposure. How do you intend to get their buy-ins into this scheme?
So, as I said, the social health insurance is the only one that has ever interacted with the informal sector. It is not a purview of the private health insurance. So it is the space that we have been focusing on largely. The ways you can get them to, I don't want to use the word compulsion, because, as we said, we are doing 6 months of awareness creation, moral suasion, understanding what the benefits are and what you stand to lose if you don't, you know, come on board. So those are the key elements of what we're doing with them. However, I think a missing element is around financial inclusion. It's easier for you to do that within the formal sector space because, you know, you can easily have deductions made, people can transfer funds, etc., because they're financially included in the scheme of things. But for the informal sector, apart from what they do with their ajo and isusu sort of things, there isn't really much of that in that space. So we are looking at financial inclusion initiatives to see how we can bring in a lot more of the informal sector. One of the initiatives that we just recently launched is our virtual booths, within markets and motor parks. They're able to, use their existing platforms to make their payments, and they can pay installmentally because obviously they make their money on a daily basis. You can't ask them to pay that, upfront. So those are the kind of initiatives that we're rolling out. We'll be rolling out one. I don't want to let the cat out of the bag, but very soon, we'll invite LTV to one of the events.
Okay, so it is an executive, there is an executive order, so it means that there will be penalties for those who don't conform to this. So I'd like you to state the penalties.
Okay, so for starters, we're trying to create some kind of barrier for you accessing public services. So you can't live in Lagos, have a car, and you won't come and renew your vehicle license, etc., which are compulsory. One of the things that you'll be required to show is that you do have the social health insurance. You must show evidence of being active on the social health insurance plan. You want to register your child in a school, you would need to show you want to pay your tax, you would need to show that you want to work with government and register with a public procurement agency, you would have to show evidence of, etc. So all the MDAs where we have public services interfacing, one of the things that we're doing is working with them to ensure that before you are able to access that service, you would need to show that you have social health insurance, kind of what we do with tax. So these are now the two absolutely compulsory things in Lagos. Yes, exactly.
So is that the only penalty?
What do you mean?
In case, definitely in every society there will be some deviants who might be thinking that government is joking. They're not going to compel me to be part of this scheme. I have my own in my office and these and that. What are the other penalties available in case there are some deviants who might not want to comply with the order of the government?
Well, we have regulations. There are sanctions and there are fines, and we're working with, we'll be working with Ministry of Justice. We have a compliance team, and those are the kind of, they are stipulated, so it's not, you can't arbitrarily decide on what is going to be a sanction or fine. Okay. Those are all documented, and those are the things that would be applied, as the case may be, when the time comes.
Okay, I've asked you this question before. Fine, the executive order is coming. There are some facilities in the state, hospitals now. When you go there, they will tell you that, okay, we do not accept Ilera Eco here, Lashma scheme is not accepted here. With this new executive order, how do you intend to integrate some of these health facilities into the scheme?
If you read the executive order, I think, I don't remember what clause, but there is a clause definitively there that says if you want to access care in either a public or a private health facility in this state, you have to show evidence of having a social health plan. So that what that means is when you come in, if you do not have it before you leave that facility is expected to ensure that you have enrolled on that scheme before you leave. So if you're paying out of pocket, for instance, you would be expected to have added on the fee for you joining the social health insurance plan, so that the next time you do come in, that kicks into place. I mean, these are things that eventually everything will fall in place. You have to start from somewhere and then you continuously move forward, as it were. I think some of the facilities that you're talking about are probably the higher end ones, who would cater to the very expensive private health plans, which is not what social health insurance is about, really. So we're not compelling, say, like the verdicts or so on and so forth to come on board the scheme if they don't want to. It will become a, what's the word, fait accompli. Eventually, we will get there. Because even if you are administering a private health plan, part of what that private health plan should have is the social health insurance plan, right?
Okay, I would like you to elaborate on the universal health coverage, but that will be after this break. The conversation continues. Stay with us.
Last 2 years ago, they have to expand Allen Runabout. Like Allen, he expand that place because the road was very tight. And another one, this Ikeja bridge, the new bridge here, the hold up always be so much in. But you create a bridge that is make it life easy, the motor easy for everybody to move to Oshodi, to move to Yanokpaja.
The Ikeja of those days, you can hardly stand the way I'm talking to you. Concerning the bridge, I will give a kudos to them because it's not easy. Because those days, for you to stand here is something else. Everywhere is jam-packed. Going to Yanokpaja, it can take you like an hour plus before you get to Yanokpaja. So Lagos State government has really done well concerning the bridge. So I give a big kudos to the governor, Mr. Sanwo-Olu, for that. It has reduced the rate at which traffic is on this road.
It will save you a lot of less time to go to your destination, especially when you are going from Ikeja to Oba. We used to charge for 400 naira before, but now we don't dey charge like that because there's no more traffic. I miss the Lagos traffic, make I no lie.
All right, thank you for staying tuned. We are still discussing Lagos State mandatory health insurance. Yes, and before we went on break, I was saying that our guest we still have with us Dr. Emanuela Zamba. She's the permanent secretary, Lagos State Health Management Agency, LASHMA. All right, so I said I want you to elaborate on the universal health coverage. Can you walk us through how this will pan out?
So universal health coverage simply just means that you are trying to provide services to as many people as possible, as many services as possible to as many people as possible at a cost that is as affordable as possible, right? That's what universal health coverage is about. So it's a journey. You will never get to Uhuru, as they say, because you cannot have all services ever provided at an affordable cost. There are some services that by the virtue of that type of service, they are expensive. But everybody has to start from somewhere, right? So for countries that you say have achieved UHC, let's look for some that's similar to us, like Thailand, for instance, that is in Asia and has like the kind of population that we are working with here. What they have a finite set of services. You can access that from all facilities. It covers everybody in the population, and it is, at an affordable cost. Now, the beauty of social health insurance is that as you go along, as you progress, and you build that pool more, you are able to add in more services to be provided at this relatively affordable, negotiated cost for everybody. So eventually, people get much more services as you journey into UHC, over time, without having to break the bank to get it, right?
Okay, let's talk about the affordability now. Is it one scheme fits all, or there are classes of this scheme?
So for social health insurance, there must be what you would decide as your basic minimum, right? Below which nobody should go. That is what we have determined as a basic minimum. Then, of course, you can have layers on it. Private health insurance, for instance, would give you added layers. Even within the social health insurance plan that we have a plan for seniors, simply because they are more high risk. They have the tendency to seek services more because of their age and, the accompanying issues and so on. So you can have variations, so to speak, but there must be a basic minimum to which everybody, regardless, has access to.
Okay, so let's talk about Ilera Eko. Some people have raised concerns about the quality of healthcare delivery they have gotten, or healthcare service they've gotten. Some also, we had a guest here on Monday, and she raised concerns about the quality of drugs at the community pharmacy. So I'd like you to respond to that.
Okay, so I will address it in, I think, two ways. The first is that we should always be mindful of the fact that Ilera Eko is not a private health insurance plan. It is a social health insurance plan. And what that means, it is for everybody and it must be as affordable as possible. That is not to say that quality is going to be compromised. Now, I think the general perception of general public, because there wasn't any social, we're working in a vacuum. Yeah, this is a pioneering initiative of the state, is that if you want to get well, you have to buy the most expensive drugs that are highly branded and so on. And those are the ones that will cure you, quote unquote, right? There is a whole spectrum of drugs that we call generic drugs. And they are brought out simply because of affordability. Now, whether you take that, you get a branded drug or you get a generic drug, the pharmaceutical component of the drug is the same. What you buy when you buy the branded drug is the name. I would use the example of a lady's handbag. You have a Louis Vuitton or a Chanel, which is like the high end. You have those that are mainstream, like the Tory Burches and so on. And then you have those that you can walk into any shop and buy a leather bag. They all have different prices. They all perform the same function. The Louis Vuitton bag is not going to last longer than the other bag that you bought, simply because they are all made of leather. You understand? So what you're buying is the name, you're buying the brand. Does not mean that the generic drug is less effective. It is just as effective as the branded drug, and it is affordable, and that is why the social health insurance plan leans towards the generic drugs. We need to get you well. It is not about the expense of the drug. It is about the efficaciousness of that drug. And so I think people already have this mindset that if I'm going to have, let's use Ampiclox for instance, it must be that one that is in the blue and white pack. Otherwise, I want. It's a psychological
so it's a mind
malaise. Thing. It's a mind thing, yes. And people need to disabuse their minds that nobody's going to give you substandard drugs. There's nothing like that. All these drugs are NAFDAC approved. They are NAFDAC approved. They have gone through rigorous tests and so on and so forth. And NAFDAC has stamped on that drug simply because they see that that drug will provide the cure that it is supposed to. It will do what it has said it is going to do. So there is no way anybody is going to be given any drug that is not NAFDAC approved or is not efficacious enough. Just don't be looking for all the bells and whistles. Let's just be functional, really.
Okay, so sorry, Jamila. So how do you also ensure that all the health facilities under Ilera Eko maintain the standard that you have set for them?
Okay, so we have a very elaborate mechanism for quality control and quality assurance. In the first place, before you come on board, there are certain hoops that you have to jump to. The law says that you have to be HEFAMA accredited, right? But when you do come to us and say, oh, I want to join the scheme, there is still a whole spectrum of stuff that's going to be done. They will come and inspect. They will give you a quality improvement plan. They will tell you whether you met the standard or not, and if you didn't, they will leave you with a quality improvement plan to go and work on. And when you're ready with all the things they've asked you to do, you can come back. And it is only when you have met that limit that you now go and become onboarded onto the scheme. Now, once you now come onto the scheme, and there's all the trainings and everything that will be done, and they'll walk you through all the SOPs, there are operational guidelines, there are standard treatment guidelines, there's an essential drug list, etc. All providers are armed with all of that. You are also taught on the ICT platform, because we are ICT based, we don't use We're not paper-based. So you'll be taught how to access the platform and upload all the things that you need to interact with or to provide to the agency. We have a quality team that are spread across all the divisions of Lagos State. And every month, they walk into these facilities. Okay. They have a list, a checklist. They will look at files. They do clinical audits. And if they see any issues, it is red flagged. And the hospital, is called to attention. We have a whole arm of LASHMA dedicated to regulation. And what that means is that when the quality team have done their checks, if there are issues that have not been able to be resolved at that level, the regulatory team now steps in and they visit that hospital. And if you'll be issued, there is a whole spectrum of what they go through. If they have issues with what has happened, you get issued a letter of warning. They will keep monitoring you. If you do not conform to what has been asked, eventually the last thing that will happen, you are fined and eventually you are delisted or blacklisted, and you will not be able to provide care to any illegal enrollee until you have gone the whole ramot again of coming back. And so it's a continuous cycle of ensuring that hospitals are providing the care that we want. We also have a 24-hour call center. It is toll-free. We have people doing shifts, sitting on those lines to ensure that if you call in at any time, somebody will pick that call. If you have an issue with the facility, what we notice is that many people just walk away out of annoyance and say, oh, it's a government program, so, that sort of thing. No, you've paid for something, it's your right. And that's why those people are there, not sleeping, waiting for you to call in. If you have an issue, there's a confusion, maybe the provider is telling you this thing is covered, is not covered, and you feel that it's covered. Call and, query the call center. They will sort it out for you, and they will engage the facility. And that is also recorded. Every week on Sunday at 4 p.m., I get a list of the complaints that have come in on our hospitals. And that is passed to the quality and the provider network team to work on the following week. So it's in real time. Okay. There isn't any, how would I call it, like a time lag. And we are constantly addressing these complaints. So we want people to reach out to us because it is what we know that we can deal with, right? Things that the quality team go into the facilities for, that is from our perspective as your clinician. But there are things that matter to a customer. I'm not a customer. Right? I expect you to raise attention. If there is an issue that you feel from your customer perspective is an issue, raise it through the complaint center. And that is taken on board and, worked on to ensure that when you go back to that hospital, that sort of thing will not happen. The hospital is either penalized, So this is a continuous cycle. We have responsibilities. But it's always good to tell our customers that you also have a responsibility to escalate to us. Let us know. You can't complain about something that you did not draw our attention to. Once we hear it, we are responsive and we are working on it. It's a continuous cycle.
So you've heard it if you have issues.
Correct me if I'm wrong. It appears that some of the subscribers to the LASHMA health insurance they over-expect certain services because there was a story that someone narrated to me. He went to a private facility, his wife wanted to deliver, and he was told to go and bring 1 million naira.
Under Iliraiko?
Yes.
No, that's not possible. That sounds like it's the story is coming from Mars. There is nothing like that. I've never heard that story. 1 million?
Yes.
Please, even in out of pockets, you don't have to pay 1 million to deliver, right?
Okay,
and it's free.
You meet the guy. When
I would want to meet him. I would want to meet him. He should tell me which hospital, and he should also say why he did not escalate it to the agency. Our numbers are, we are constantly screaming, and it's toll free. So it's even if you don't have credit on your phone, if you dial, it'll go. We are footing the bill simply because we want to hear from you. That's why we're there. It is true that hospitals will always try to game the system. Right? And so you, as the customer, you should know your rights. We have an enrollee handbook that we give out to you. They'll push it to your WhatsApp. Immediately you join on, and it gives you all the information. But sometimes we realize that a lot of us, and I'm using myself as a customer now, from that perspective, we don't bother to read the fine print. We are given the benefit package. You don't bother to read through it. These are the services that I am actually entitled to. you are given the enrollee handbook, you don't bother to read through it, right? You just have this assumption that you have not tried to ground in the actual facts. And so you walk into the facility with what you think is your entitlement, so to speak, and then you meet a sudden or whatever. If he had read the benefit package, he would know that cesarean section is covered for free under Ilera Code. Once you have paid for a family plan, it is free. They will not collect a dime from you extra. And we have testimonials. Every week we put out testimonials on our social media pages, either from the Ekosha, who are the vulnerable program that we have, or those that were paying. And dozens, thousands of people have testified that they got their CS section free. I just got a message this morning that we had a quadruplets born in a hospital. I'm just trying to find out which hospital so we can go and visit the children. And they're not going to collect an extra dime simply because there are 4 babies that came out of that stomach. A CS is a CS. And we pay that as a fee for service to the hospitals. So it's not part of the capitation that they get. They will give us that claim and we will pay it after the delivery.
Okay, whose responsibility it is now, like an agency of government, when they deduct, they took in from their members of staff, whose responsibility it is to ensure that the payment is done to your agency?
What do you mean deduct?
Okay, like if you deduct a certain amount from my salary now monthly, how do you ensure that it gets to your agency or to the clinic? So that when I go there, they will not tell me that, oh, your money has not been paid, so you cannot receive treatment at this particular time.
All right. So if you're working in a company, for instance, your HR would have sent us the list of names of people to be onboarded onto the scheme. And you pay your premium. It's called a premium, which is in our case 15,000 for an individual for a year. Let's just use the individuals. Or family is 55,000 for a family of 4. So you will pay your premium. We have flexibility to some extent, but not really for corporate Lagos. So you pay your premium upfront. Now, once that money hits LACHEF, which is the health fund that we administer, every month the agency takes out an amount per person per month, and it is sent to the facility under which you are empaneled for your care. So whether you walk into that facility or not, that fixed amount is paid. So for a family of 6, for instance, we will pay that amount per each member of that family, and it goes to that facility upfront. We pay within the first week of every month. Since LASHMA started, I make bold to say we have never defaulted on payment. That money will go like clockwork to that facility for your care, whether you come in or you don't come in. And that is what we call capitation. Now, there are some services that are not covered under capitation. For instance, the cesarean section that we talked about. When your wife has gone for the cesarean section, because it is covered, the hospital will now make a claim, send us a claim after the delivery, right? Which they should have uploaded onto the system. We give them a number of days to be able to upload that to the system. And within 60 days, because the 60 days is the lag, you send us, and then we now send you back the money. And you get your claim. The hospital is now paid for that service. So they're not expected to collect an additional dime from the patients because the agency is going to pay on that person's behalf.
Okay, so I want, so in terms of emergency cases now, you know, does this policy allow for emergency cases? Maybe the person is brought in and cannot identify himself, that he has a health insurance scheme or something. So is there room for that person to receive adequate health care even without being able to identify himself?
So the beauty of IT is that you can pull out someone's information from the system. As long as you know the person's name and the names that they use to register themselves, for instance, the system can give you your policy ID on inquiry. This is the policy ID of this person that has come in. And yes, you'll be able to access care as an emergency care patient.
Okay.
Okay, so far, I know you have had so many successful stories. What has been the challenges facing the agency?
The first one is what we talked about in terms of the mindset of our people and the culture, and the fact that it was not compulsory. Anywhere in the world where there has been success at UHC, it is because there is compulsion. The government makes it a compulsory thing for people to sign on to. So that was an issue that you could decide to opt in or opt out, right? Which the executive order is going to try and clear. The other thing is the economy. So even with when we started and where we are now in terms of the prevailing economy, we know that it's not easy. So for people that ordinarily do not prioritize their health, right? Very important things like stomach infrastructure, for instance, are prioritized over health, which is normal, right? Trying to get them to now understand when there is serious cost constraints is a serious challenge which continues to be there. And that's why we bring in, the flexible payment mechanism, which we call pay small, small. You can pay monthly, you can pay quarterly, you can pay half yearly rather than having to pay up front. And then we also have on the ECOSHA arm, which is Eco Social Health Alliance, the 1% of the equity fund that Mr. Governor has provided to the agency, which is now like a first line charge. That fund is used to cover people that cannot pay for themselves, the vulnerable in the society. We also have people that work with us in terms of supporting maybe particular subsegments of the population. So we have development partners also sponsoring some lives. We have well-meaning members of society, NGOs, politicians, etc. A lot of people come together to support what we're doing. And yes, we have that opportunity to be able to cover those that are genuinely struggling.
I just got a particular message on my message now from someone, and is asking me to tell you that there is need for LASHMA to check those in general hospitals because they do collect money from people. That his wife delivered last year. It happened to me last year. I'm still asking him to tell us what actually transpired when he was at that facility. It's a general hospital anyway.
So one thing people need to understand, as I said before, is that yes, regardless of whether it's a public or private hospital, sometimes facilities will try to either play on your intelligence or just try to be smart, generally speaking. And it's your duty to cry out, right? We have a system in place where not only will that hospital be visited and the normal issues of penalizing or sanctioning will take place, we also deduct that amount that was taken from you from what is supposed to go to that facility the following month, and you are refunded. So the hospital is given the option of either refunding, call the enrollee that you disenfranchised and pay him back, her or her, the fund that you collected illegally, or it will be deducted. So whenever you're going to get the next, which I said we pay on a monthly basis, we will deduct that amount and it will be refunded to the client.
Even
all you need to do, oh yes, all you need to do is provide the receipts and so on and so forth, and you will get your money back. You'll get your money back.
Okay, so for residents who are still hesitant or skeptical about this, what do you have to say to assure them of quality healthcare delivery?
So I will say, as I always say, the taste of the pudding is in the eating. You cannot beat the affordability of the premium that you're going to pay under Iliraiko. You cannot compare the price that you're paying for the scope of benefits that you're receiving under the scheme. We're assuring you that you will get quality. There are loads of people testifying to the goodness of Iliraiko, let me put it that way. And you just need to come on board. Our governor has gone a long way to support the agency, right, in terms of subsidizing the premiums that you need to pay, and you will not get any less quality, as I have been trying to reiterate here. So just join the bandwagon of Iliraiko before anybody comes wielding any. It's not necessary. It is a way to keep your family safe, ensure that you have quality of life, and you can use the excess of monies that you would have had to pay out of pockets to do, more qualitative things, find better schools for your children, etc., and things like that, rather than wait until the day illness comes visiting, and you will not know how many hundreds of thousands or millions you'd have to bring out of your pockets. Whereas if you had just paid this 55 or 80,000 that you're being asked to pay, all these services will be provided to you free of charge.
All right, we must thank you very much, Dr. Emanuela Zamba, Permanent Secretary,
Thank you
Lagos
for
State
having me.
Health Insurance Health Management Agency, LASHMA. She's been speaking to us on the Lagos State Mandatory Health Insurance Scheme and the need for all of us to come on board. We stand to gain a lot by coming on board this particular scheme introduced by the administration of Mr. Babajide Olushola Sanwo-Olu. We thank you very much for your time, and
Thank you.
we thank you for the service that you're rendering to Lagosians and Nigerians in general.
Thank you.
Okay, we'll take a very quick break on the program. When we come back, the show will continue.
Let the conversation continue.